If you feel a sharp, shooting pain radiating down your leg, you probably think your hamstrings are just tight. So, you bend forward to stretch them out. But wait, the pain doesn't stop. It actually flares up. It burns, it tingles, and it gets worse. Let's talk about why. You go to your doctor, and their first advice is to stretch. You search the internet, and every guide recommends the pigeon pose or deep hamstring stretches. But every single time you try them, your leg feels like it's literally on fire. You're not alone, and there is a very simple reason for this. Here is the hard truth you need to understand. Your sciatic nerve is not a muscle. It doesn't have elastic fibers. It's a thick, sensitive neurological cable. And when it's inflamed, stretching it is like pulling at a raw, open wound. It doesn't want tension, it is screaming for space. But what if the key to relief is not pulling the nerve, but letting it glide? Your nerves are naturally designed to slide smoothly through your muscle tissues. Once you restore that space, the shooting pain can finally stop. In this video, I will walk you through exactly why stretching makes your sciatica worse, the biological reasons why your nerve gets trapped, and 5 simple, gentle habits to restore space and pain-free movement. No gym, no stretching, just smart biology. Mechanism number 1 is nerve tensioning versus gliding. Muscles are highly elastic. They are built to stretch and expand. Nerves, however, are not. When you try to stretch a sensitive, inflamed nerve, you narrow its blood vessels and cut off its oxygen supply. We call this nerve ischemia. Instead of pulling both ends of the nerve at once, we need to floss it. This means gently pulling one end while relaxing the other. The nerve then slides smoothly back and forth, which helps clear out inflammation without any irritation. Mechanism number 2 is piriformis entrapment. The sciatic nerve runs directly underneath a small hip muscle called the piriformis. When this muscle spasms or tightens up, it acts like a mechanical clamp, squeezing the nerve directly against your pelvic bone. If you try to stretch this muscle aggressively, it actually reflexively tightens up even more, compressing the nerve harder. The solution is to relax this muscle dynamically, releasing the clamp rather than pulling it. Mechanism number 3 is lumbar disc compression. The sciatic nerve is formed by nerve roots exiting your lower spine, from L4 to S3. Gravity and poor posture compress these spinal discs, narrowing those exit doorways and pinching the nerve at its source. And finally, mechanism number 4 is neurogenic inflammation. When the nerve is pinched, it begins to swell. This internal swelling, or intraneural edema, makes the nerve physically thicker, trapping it even tighter inside its narrow pathways. The good news is that we can reverse all of this by changing the physical signals we send to our body. By decompressing the spine and gliding the nerve, we help drain the swelling and release the clamp. Let's dive into 5 safe daily habits you can start right now. Habit number 1. Seated sciatic nerve flossing. Sit upright on a chair. As you slowly straighten your painful leg, gently tilt your head back to look at the ceiling. Then, as you lower your leg back down, bring your chin to your chest. Do 10 slow, controlled repetitions. You are gliding the nerve smoothly through both the knee and the hip. Habit number 2, the supine sciatic glide. Lie flat on your back. Support the back of your painful thigh with both hands at a 90-degree angle. Slowly straighten your knee, but make sure to keep your toes pointed toward the wall, not back toward your shin. Lower it gently, and repeat 10 times to glide the nerve from the hip end. Habit number 3, the 90-90 spinal decompression. Lie on the floor and rest your calves on a chair or couch, so your hips and knees form 90-degree angles. Just relax here for 5 to 10 minutes. This position completely unloads your spine, letting fluid re-enter your discs and widening the exit doors for your nerves. Habit number 4, pelvic tilt soft glides. Lie on your back with your knees bent and feet flat on the floor. Slowly press your lower back flat into the ground, tilting your pelvis slightly upward, then release. Continue this gentle rocking motion for 2 minutes. This creates tiny, safe movements in the L4 to S3 nerve roots without stretching them. Habit number 5, Piriformis soft glides. Lie on your back, knees bent, with your feet set slightly wider than your hips. Slowly let your knees sway from side to side like windshield wipers. Keep the movement small and completely pain-free. This dynamically relaxes the piriformis muscle, easing the pressure on the nerve beneath it. And now, the morning bedside protocol, your 60-second shield against sciatica. When you sleep, your spine absorbs fluid and swells, which is why sciatic pain is often worst in the morning. Before you even get out of bed, do 30 seconds of gentle pelvic tilts. Then, sit on the edge of the bed and do 3 seated nerve glides. This prepares the nerve for standing. No aggressive stretching. No pulling on raw nerves. Just 5 simple daily habits and a 60-second morning shield. By working with your biology instead of using force, you give your sciatic nerve the space it needs to heal. Within just 2 to 3 weeks of consistent gliding, you will really feel the difference. The sharp, shooting fire in your leg will start to fade. Standing up will feel much easier. You are not just managing the symptoms, you are truly addressing the cause. Let me know in the comments. Have you been stretching your sciatica in the past? And which of these habits are you starting tomorrow morning? I read every single comment to support your journey. If this video gave you some hope, please click subscribe and share it with someone who is struggling with leg pain. Together, we can learn to work with our bodies, not against them. This video is for educational purposes only. Always consult your healthcare provider before starting new exercises. Take care of your body, and I'll see you in the next video.